up, we have Niyera Nyandagaro, sorry if I mispronounced it, who's a pre-med undergraduate student at the University of Utah. And they were born in a refugee camp in Lukole, Tanzania in 2002. They arrived in Salt Lake City in 2007. They're the oldest of 5 kids. They're a first generation undergraduate at the University of Utah pursuing health, society, and policy, HBS, so an honors of Bachelor's of Science. They are a sophomore that's about to go into their junior year, and something that that they are passionate about is health promotion, equity, and serving underserved communities, and enjoy watching K-dramas, listening to all kinds of music, cooking African dishes, and braiding their own hair. So we welcome you, Niyera. Thanks for coming to present for our presentation. And then we have Dr. Adebayo Adesomo, who is a Houston, Texas native. They recently moved to Salt Lake City to complete a fellowship in OBGYN department at the University of Utah. They specialize in maternal fetal medicine, a subspecialty of OBGYN, which focuses on high-risk pregnancies. And they have authored research publications on COVID and pregnancy in the American Journal of I'm sorry if I'm having a hard time pronouncing my words today, obstetrics, OBGYN. He is passionate about understanding and rectifying racial disparities in healthcare as they relate to pregnancy outcomes in the United States. So just wanted to let you also know that this meeting is going to be recorded so we can review it later on. After the presentation, we will have a moment for some questions. So feel free to please add those in the chat, and I will address it from there. Otherwise, I'll turn the time over to our guest speakers and we will get started.
Thank you for the introduction. I will pass it over to you, Niyera, to get things started for us.
All right, thank you. So the first thing we're going to be touching on is maternal morbidity and mortality, plus the disparities within that.
Yeah, so I will start us off just by anchoring this discussion about COVID-19 pregnancy as it relates to Black women with a brief overview of maternal morbidity and mortality here in the United States. Just some definitions. So there's a lot of focus right now on maternal mortality, which is defined as a pregnancy-associated death. The number that you usually see associated with maternal mortality is essentially a rate. So the 26.4 that you see on the graph here on your left basically means that for every 100,000 births here in the United States, 26 women die from pregnancy-related causes. In contrast, maternal morbidity is when a woman suffers from a life-threatening disease or condition that requires a life-saving intervention during a pregnancy. So that number tends to be a lot higher as we have a lot more women experiencing severe conditions but are able to be saved, but some unfortunately do end up in maternal deaths. Some important points to note here are that here in the United States, we have one of the highest maternal mortality rates as compared to other developed countries. And there are many reasons for that, some of which have to do with healthcare factors, some of which have to do with patient factors, some of which have to do with systems factors. There's a complex web of reasons and causes as to why maternal death happens. And we just so happen to be in a country where, unfortunately, it's higher than others. On the right here, you can see some of the reasons as to why a pregnant mom may lose her life during a pregnancy. Bleeding is common. Infections can happen, which can be life-threatening. High blood pressure disorders in pregnancy can also threaten a woman's life. And then other complications from a delivery, including unsafe abortions.
Now I'll go and speak on the maternal mortality crisis and give some history context. So the CDC now estimates that 700 women die each year from complications of pregnancy, and more than half of these deaths and near deaths are from preventable causes. And then there is a disproportionate number of women suffering, and those are Black women, where we see that Black women are 3 times more likely to die from a pregnancy-related cause than a white woman. And in some women experiences, once the baby is born, the baby becomes the sole focus of medical attention. And then that makes mothers become monitored less, and their concerns are often dismissed. And when they get sent home without sufficient information about potential concerning symptoms, and we see patterns of Black women expressing concerns about things like symptoms they're experiencing, and clinicians delay to address them or seem to believe them less. And we see this prevalent in rich and famous celebrities, which goes to show that there is an unconscious and racial bias present in our healthcare system. And this discrimination is harmful for the Black community. And health disparities are driven by social and economic inequalities. And this can be traced back all the way to slavery, where for Black women, childbearing was an investment that benefited the interest of slave owners. And for certain medical specializations like the obstetrics and gynecology, they were on the hands of enslaved women who were the experimental subjects, where in most cases it was non-consensual and done without anesthesia. But when J. Marion Sims, who is now the father of gynecology, would go and travel to Europe to do procedures on wealthy white women, they were sedated to not feel pain or too much discomfort, while the Black women were thought to not experience pain. So I think learning about the history can help us better understand the medical racism that exists today. So what can be done to address the structural racism and social determinants of health? So first, we should all be able and willing to admit and acknowledge that we all have biases within us. So the very first thing clinicians can do to tackle bias is to find out what their biases are, and then to be able to recognize them when they're taking place, and to make sure they don't come in between their care of their patients. Another alternative is pregnant women can explore new and different ways that best meet their needs and wants. And one option is midwives, who closely focus on your preferences, culture values, and personal wishes for emotional and social support during your birth experience. And again, for more funding of social services and research, health promotion, risk prevention, and training healthcare workforce to identify and treat early warning signs. So now I'll go ahead and highlight some community resources that are available. So the first one, WEAK, which stands for Women, Infants, and Children, helps vulnerable families put healthy food on the table and address racial disparities in maternal and child health outcome. And the Utah Department of Health provides Medicaid, which covers healthcare expenses for the mother from the date she submits her application and 60 days after the birth of the child. And Baby Your Baby is similar to Medicaid, where they help cover your medical expenses and your visits that are related to your pregnancy, but Baby Your Baby does not cover your delivery. Another resource is Planned Parenthood, which offers affordable healthcare and education, and a wide range of services like preventative care, birth control, testing and treating STIs, and screenings for cervical and other cancers. So they don't just solely focus on abortions or women's health. Men can also seek services from them. All right, so I'm sure we're all a little versed on what the coronavirus is, so I'll go ahead and give some COVID basics. So COVID-19 is an infectious disease that is caused by a virus, and it was discovered at the end of 2019 in Wuhan, China. And as we know now, it is very contagious and fatal. And while this virus may affect other parts of our body, it attacks our lungs and respiratory system. And the groups that are at risk are those who are the elder and those with underlying health conditions, as well as those who are pregnant or were recently pregnant. And in Utah, there's been over 900,000 cases and over 4,700 deaths. And in the United States as a whole, hundreds of thousands of people have died from COVID-19. So COVID and pregnancy. So COVID-19 strikes the respiratory and cardiovascular systems, which are the two systems already strained during the pregnancy. So this pandemic has only worsened this crisis. And people who are infected with the virus are twice as likely to be admitted to the hospital and require intensive care compared to those who are not pregnant. And those who are pregnant also have an increased risk of death. So vaccination is an important tool to decrease these risks.
So I'll talk about physiology and pregnancy and tie in why pregnant women may be at increased risk of having worse outcomes if they have COVID in pregnancy. The body has to adapt to a growing baby and a growing pregnancy, and it does this through a number of changes in a woman's body. So there's changes in the immune system to allow what's called quote unquote fetal tolerance. We don't want the mother's body to be attacking the baby as a potentially foreign organism. There's changes in the cardiovascular system, so changes in the heart, changes in the blood vessels. This can also potentially add some increased stress on a mother's body. In addition to the heart system, there's changes in the lung system, as well as changes in the blood and clotting system. So all of these changes that aren't typically present when someone's or a woman is not pregnant can happen during pregnancy. And these changes that are happening during a pregnancy may in turn put women at increased risk for having worse outcomes if they have COVID during pregnancy. And of course, we can't forget that a major part of the pregnancy is growing a healthy baby. So there's what we call a fetal placental unit. So that's just the baby and the placenta. And this is where the baby gets nutrients, oxygen, and other necessary things for growth and development. So you can imagine that if a mom is not getting the appropriate oxygenation that she needs, in turn, the baby's not going to be getting the appropriate oxygenation it needs to grow and be healthy. So these are just changes to keep in mind during a pregnancy that can be affected during a coronavirus infection.
So COVID vaccine in pregnancy. So across the United States, COVID-19 vaccines are widely available for all adults and children ages 5 and older, including people who are pregnant. And during pregnancy, vaccinations are a safe and routine part of prenatal care because it reduces the risk of hospitalization and admission to the ICU or death. And you can also get vaccinated at any trimester of your pregnancy. And the vaccine results in transfer of antibodies to the fetus, or the transfer can happen through the breast milk. And pregnant people have the same side effects from the vaccine as non-pregnant people. And they also seem to have the same benefits from the vaccine.
So, bottom line for coronavirus vaccines in pregnancy is that they're recommended. All of the governing bodies, including the FDA, the CDC, and the American College of OBGYNs, after reviewing evidence of coronavirus vaccines in pregnancy, have deemed them to be safe and recommended for pregnant women. As I was mentioning about the fetal placental unit and the need for oxygenating mom to get oxygen to babies, a simple way to think about this is you need to have a healthy mom to have a healthy baby. And I think sometimes there are concerns with mothers not wanting to do things like vaccinations during pregnancy due to potential harms to the babies, but we haven't seen any evidence of that. And once again, in order to best protect your baby, you have to protect yourself first.
All right, so now we'll be debunking myths and some misinformation that's spreading about COVID-19, pregnancy, and vaccines. So the most common misinformation is people saying that vaccines give them the COVID infection. And this is false because when anyone gets vaccinated, there's a little piece of replicated material, which is called RNA, that is introduced, but it is not a live virus, so it cannot cause infection, and it does not get incorporated into your DNA. And what vaccines do is teach our immune systems how to recognize and fight the virus that causes COVID-19. And when you get vaccinated, some people may experience side effects such as fever and like other flu-like symptoms. And these symptoms and side effects are normal, and there are signs that the body is building protection against the virus that causes COVID-19.
I'll talk about this next myth, which is that COVID-19 vaccines affect fertility. There currently isn't any evidence that supports that theory. We haven't seen any increased risk of infertility or problems with getting pregnant in women that have gotten the COVID-19 vaccine. So that's really all I have to say about that one. So we can move on to the next one.
And another myth is that the COVID-19 vaccine is made from aborted fetuses. And the fact is the vaccine is not made directly from aborted human tissue. But one of the vaccine, the Johnson & Johnson's vaccine, was derived from a clone of a cell line from tissue that come from an aborted fetus from many years ago. But the Pfizer and Moderna vaccines were never related to any cell lines that come from aborted tissue.
The next myth is that vaccines increase risk of miscarriages. This was something that I think came out relatively early in the vaccine and pregnancy, this myth at least. What people didn't really appreciate was that the rate of miscarriage is higher than I think is commonly thought about. And when you compared the rates to women that had gotten the vaccine to just the general rate of miscarriage in a normal pregnant population, the rates were unchanged. So there's not any evidence or really any theory that would support a reason as to why the vaccine would increase risk of miscarriage.
So while I was preparing and researching for this topic and this presentation, I found out that April is the week of April 11th through the 17th is Black Maternal Health Week. And it is recognized each year, and it's again to bring awareness to the Black maternal health. And in general, the month of April is recognized in the United States as a National Minority Health Month-long initiative, again, to advance health equity across the country on the behalf of all racial and ethnic minorities. So that is the information we wanted to share with you all. Now we'll turn the time to you guys to ask us any questions or voice any comments that you have.
Awesome. Thank you so much for your presentation. We appreciate the information that you provided and find value in that. We do have a few questions here. Let me just pull it up really quickly. So Gary wants to know, can pregnant women be given boosters to increase the general health of the baby?
Yes, that's a great question. So when the booster shots were being recommended to the general population, That also included pregnant women, given that they have been deemed to be a high-risk population as it relates to the coronavirus infection. So we have been recommending boosters, the coronavirus boosters for pregnant women as well, for similar reasons that the general population was also recommended to get them. And then it looks like Gary also had a question about antibodies being transferred through breastfeeding. And so that is something that, so we do encourage both the vaccine and the booster for that very reason. So not only do you get antibodies throughout the pregnancy, depending on at what point you get vaccinated, the earlier the better in terms of getting transferred to the baby, but also through breastfeeding, some antibodies will transfer over via the breast milk.
Thank you. So in that case, do you have like an initiative to more strongly recommend women to breastfeed their babies, especially if they have the COVID vaccine?
Yeah, so we always recommend breastfeeding as the just best method for feeding babies in the postpartum period. And I think that there's even more emphasis to do so in the context of protecting babies against, giving babies some protection, some antibody protection that the moms can generate from other infections. So, generally, we strongly recommend breastfeeding for both the baby's health and the mother's health, but even more so in the context of coronavirus.
Thank you. Have you noticed any disparity in the treatment of that approach for Black women versus traditionally white communities when it comes to the messaging for breastfeeding? I know earlier you were talking about some biases, and I was wondering if that was one of them.
I haven't noticed any explicit disparities in messaging. I think the issue a lot of the times is that things are much more implicit, and although there may be a guise that everyone is getting the same message and getting the same encouragement, there may be some communities like minority communities and Black communities that maybe aren't getting the same emphasis on the importance of breastfeeding or aren't getting the same education. So nothing that I've noticed explicitly, but I think that physicians are trying to do a much better job at checking their implicit biases so that they're giving everyone an equal opportunity, an equal playing field in how they deliver their counseling and their messaging.
Thank you. The next question that we have here is from Richard, and Richard would like to know if it's safe for a pregnant woman to receive the flu and COVID vaccine together.
Yep, perfectly safe. Some women do prefer to stagger, meaning get one shot at one point and another shot at another point, just because I think generally speaking, people just don't like shots. But we oftentimes have women getting both shots at the same time just to be more convenient. So there's no health concerns with getting both shots together. As Niyera was mentioning, vaccines in general can cause some side effects. Most commonly, the one that I think we all typically experience is arm soreness. There are some other side effects that people may also experience with the COVID vaccine. But I think it's important to realize that, as Niyera mentioned, that's not the infection itself. It's just a normal side effect of getting a vaccine the same way your arm becomes sore from the shot.
Okay. Would you say that there would be an increase in the symptoms when individuals do get both vaccines at the same time, or in your experience, have they been relatively similar regardless of together or separate?
Yeah, I think, theoretically, if you got 2 shots in 2 arms, or 1 shot in 1 arm and 1 shot in the other, technically you'll probably have two arms that are sore instead of one. So I think just in that vein, you may experience more side effects. I don't think there's any current studies that have looked at that, looked at side effects from getting both shots at the same time versus one at one time and one at another. But that's something that is actually a good question that need to do a little literature review and see if anyone's looked at that.
Awesome. Thank you so much. More so, I was wondering, like, would there be longer fevers or higher temperatures and things like that? But thanks for sharing that. We're not quite sure. I appreciate that. So let's see here. The next question here is related to fertility. I might modify the question a little bit. So this comes from Donica. So Donica wants to know, or say, there's been so much talk about vaccine causes changes to menstrual cycles. And I know you mentioned earlier that it doesn't have effect on miscarriages or on terminating pregnancies or on fertility. But my question to that would be is, how can the COVID vaccine have proven side effects related to the menstrual cycle, but not impact the ability for a woman to ovulate if her cycles are being affected by the COVID vaccine?
That's a great question. I think that it's important to acknowledge that a menstrual cycle can be affected by a number of things. I'm sure, we've all heard of menstrual cycle patterns changing depending on what populations you may closely cohabitate with in terms of, women joining different groups or things like that. So I think that just goes to show that a menstrual cycle can be affected by a number of different factors. What's most important in terms of fertility is your ability to ovulate. So as long as you're still having an ovulatory episode where during your cycle you release an egg to potentially be fertilized, changes in your menstrual cycle length shouldn't necessarily affect the ovulation aspect of your period. So hopefully that answers your question.
Thank you. Just to follow up on that, how is semen impacted by the COVID vaccine and the and fertilizing an egg? Do embryos automatically get some kind of benefit from the father the same way they would from the mother who has the antibodies?
So this is actually one question I don't feel too bad about tapping out on, given that I'm not, I don't see men at all. I'm not sure how the coronavirus vaccine affects sperm. Just kind of hypothetically or theoretically speaking, I can't really think of of any reason why the vaccine would positively or negatively affect the actual fertilization episode. So where sperm meets egg. I think a simple way to think about it is, you want to be generally healthy. You don't want to be in the intensive care unit. You don't want to be very sick in the hospital. Those are potential reasons that could affect the fertilization episode in kind of different realms. But otherwise, I don't really know of any specific reason as to why the vaccine would affect sperm meeting egg.
Awesome, thank you. So the follow-up question here is, let's see. Someone would like to know whether or not breast milk can actually transfer the COVID-19 virus to the child if the mother has COVID when they're breastfeeding.
Yeah, so we have been, there's been kind of changes and alterations in the recommendation as we've gotten more information. And we've recommended that our pregnant women that have the coronavirus infection basically try and emulate what a normal non-COVID infected woman would do. So, the thought behind that is you already have an infection that could potentially affect your outcomes. You don't want to start adding on other things that could potentially give you worse outcomes from both a maternal or a baby perspective. So limiting the breastfeeding would potentially definitely do that. So, the most important things are getting the vaccine to try and prevent the infection. But if you happen to get infected, the next key is to basically try and do all the other recommended healthy things like breastfeeding that a normal postpartum woman would be doing.
Awesome. Thank you so much.